Yeah, we are done. And on the first day of my anatomy classes, I was very astonished as to see the cadaver in the anatomy lab. So full of dead patients. I mean, the dead people. So each had about some 10 cadavers each table, and belong to the F batch, and my number is 1010911091. And so like I had new friends, and but they were from different. But in engineering college, we had people from different parts of Salem. But in the medical college, people were from different regions of Tamil Nadu. They're from Tiruchi, Theni, and all of the regions. So we'll start with the upper limb, and listen to my pronunciation. Um, so it has been 10 years since it was August 1, 2009, in which we joined our medical college in Vinayaga Mission Kirubananda Variyar Medical College and Hospitals in the Vinayaga Mission University, which is deemed to be a university. And so as a chairman of the college, I would like to say about the beautiful things which I enjoyed in anatomy. So, introduction to the upper limb. It's the homologous part of the limb, and we had a different kind of names, but we are familiar with the shoulders and the arms, the elbows, and forearms, and the wrist, hand with the carpus, metacarpals, 5 digit, and the hip, and so the thigh with femur, and the knee joint, the legs with tibia and fibula, the ankle joint, and foot with tarsus, metatarsals, and 5 digits. So, and the parts of the upper limb. So then I have underlined all of the important words which I didn't know. So I have underlined about the manus, the hand. Hand is also called as the manus. So it is the manus. So in Tamil we call it as manus. So in English it is manus. So there is a difference in the word actually. So manus is an Egyptian word. So and the sternoclavicular joint. It is a joint between the sternum and the clavicle bone. So I was very anxious to have see the bones and the set, but I did not have it for myself in the home, and still I would love to have it because I like to see. But there were a lot of confusions with the different parts of this. The different notches and the bone parts and the important ones, making a very confusion for the medal exam. And so then the acromioclavicular joint, and so it's the joint between the acromion and the clavicle. So acromion of the process of the bone, and acro means it's a colored. Acro is color, and the color process of the bone. I mean the femur. The tibia and the fibula is the lower part, and the top is the humerus of the acromion. And So uh, and we had this flexion and extension and different things, and the pronation and supination, that is that vendicha vegalaya, so up and down, and like nandu varudhu nari varudhu kichi kichi kichi. So usually the grass path which I walked by was like that. uh, so like even people have this affordable, people is affordable to treat an bigger giant animal. So if you lay a concrete or a path on it, so it has some um, um, vibrations to it if it is underneath. So then also a lot of I started from the first page itself to learn. I was very much interested, and we did not have some question and answers too much, but I started learning all the one words and remembering. So the parts of the upper limb is given, and as usual you know about it. So then we have chapter 2, the bones of the upper limb. So I think I can finish this book in some actually totally each of the things need about a hour, but to the fast I could make it some 3 to 5 videos, maybe some 2 to 3 videos I could finish it, because we still have 2 more chapters, I mean 2 more books, and we have biochemistry and physiology, and it will be like the name etymology of these countries. So it will be it'll take a long time, and we have less of time because we need to move on to the next session in the Salem Central. So we have the clavicle. So I need to give a review about all of these so that we get approval for another upcoming event. So it was great enjoyable event in the college and the school. So we make it better this time, working event, and we have a lot of workers. Everyone in this world is a worker, and so then we have this conoid tubercle and the trapezoid ridge and all. And see the names and all. So conoid and the trapezoid, so it's inclusion of the mathematical also in medicine, so that like these are the words of medicine. They were introduced into the mathematical terms in the modern terms. So in school we are in France, so it is like we are in France, it's all of the modern age, and in college it's all of the old and treasurable items. So then so we have the subclavian groove. So groove is a small hole in which the bone fits in, and we have the subclavian. Subclavian, sub is below and clavian is the clavicle. So and we have the nutrient foramen. Groove is like a spiral one, and foramen is a small hole which fits in, and usually grooves are opaque and foramens are like almost open. And so and we had the peculiarities of the clavicle. These are of much importance to determine the difference between the human and the animal bones. So we had anatomy. I just met my monkeys in the Mudumalai forest today, and so there so the anatomy of the monkey is the first anatomical ever found by Cunningham, and then we had the human anatomy. So this human kind of species is less found in the world. The monkey kind of species is more found reasonably. So the first was the animal anatomy, and then comes this human anatomy combining all of the animal anatomy. So we must thank the monkey first. So and so even the anatomy applied in these making of the jewels. So what I'm wearing is the peacock anatomy. So it is the segments of the peacock and how the internal and the external organs look, and so it is about a teaching. Even I have the monkey anatomy also, and all my jewels collection. Then I started collecting more of jewels, and and we had the attachments of the clavicle. So we'll see the importance of the ligaments. So we have the coracoclavicular ligament. So the coracoclavicular ligament, it means the coral along with the or it might denote the coke in the coral mining region. So coke is a form of powder, and coke is also what we drink, but coke is a form of powder or a liquid, and the clavicular, somewhat resembling the phosphorus kind, not easily evaporable like phosphorus, but it is easily absorbable in water. So we have the coral and the coracoclavicular ligament. So what it denotes is we have these oil-like ligaments which vanishes in our moon phase of our health. During a new moon day, all of these ligaments vanishes. These light coke-like ligaments vanish, and we get new of the ligaments. So it is absorbed in through the air bubbles, or the water in the interstitial cell tissues and all. Then we have this costoclavicular ligament. So costoclavicular ligament, you would have heard of Costa Rica. So and the coast also. So the Costa Rica is full of bluish poisonous jellyfishes, stingy, and the stingray. They have the hooks and all. So these costoclavicular ligaments, like the stingray, have a hook like. So see the costoclavicular ligament. It has a triangular hook like up and down attached. And see the costoclavicular and the coracoclavicular, the conoid and trapezius part of the coracoclavicular ligament. So it is attached plain on a 2D surface. So And we have all of the articular discs and the interclavicular ligament. So the articular disc is complete, which means the bone is aged. It means it has developed in the womb itself. The bone has developed in the womb itself and is the most oldest of the bone. And it also means the bone is developed from an old organ, which is dating back than other new organs. So we'll come to the organ session later, but to an extent, an old organ, to say it is a lung or the liver or something like that. So the new organs are like the spleen, the gallbladder, and the pancreas, all of the light colored organs. So, and the clinical anatomy of the clavicle is given, and it's like cleidocranial dysostosis. The clavicle may be congenitally absent or imperfectly developed in a disease called cleidocranial dysostosis. So, coming to Cunningham, it is like congenitally absent. So no human is without a clavicle, but congenitally absent means these clavicles undergo oxidation. The ligaments of the costoclavicular, the ligaments, so you can say it as ligaments in the coast, they get oxidized with the abundant oxygen and they get absent. It means they enter into the oldest previous form of life, and they stay in the stable form. They don't undergo growth, they don't undergo growth, and it means congenitally absent. So, and they also cannot be made to grow more, you can't get a big shoulder, you can't be a weight lifter, like something like that, and imperfectly developed in a disease called cleidocranial dysostosis. Cleidocranial, it means cleido means there is a separation, and cranial dysostosis, it means cranial. Cranium, we have a part of the brain as cranium. So crane, it also means this you would have seen a conch shell. So the conch shell is known as the crane, and so it means there is a cleido, there is a separate in the conch shell, and there is a dysostosis. Dysostosis means there is a disaster, and in this condition the shoulder droop and can be approximately anteriorly in front of the chest. So the shoulders drop and they are in the front of the chest until we are well nourished. So most of these causes, bone disorders, are due to the malnourishment, so that these old organs like lungs and the liver, they can't make it to the new of the ligaments. So women get pregnant, they get child, and they have 2 or more children. So that's because of the more of the ligaments produced by these new organs of this gastrointestinal tract, and of the uterus is an old organ, and even the prostate and the testis and all of this are old organs. But the new organs nearby to the uterus, the spleen and all of the parts of the uterus, some of the parts of uterus like the ovary, they are the new organs. So they are white in color. So they produce a lot of ligaments and proteins which nourish the baby and make them reproduce. even men get mature, but above the stomach, above the abdomen, these organs are lacking of the ligaments, so that the shoulders drop, and so then we have the scapula. And nice like this architectural explanations are given, so that if you are very well wishing to learn about the ridges and the anterior, the posterior, and all of these words, very well learn. Because I would have already missed mathematics in college. So then we have the borders, and we have the suprascapular notch. So we have notches. Notch is not a groove. It's not a foramen. It is not a fossa. It's like the notch is not a small dipping, a compression in the bone. So we have the above scapular notch, and we have the infraglenoid tubercle. So glenoid means it's of the fat, and infraglenoid tubercle, it means the below the fatty portion, there is a tubercle. So in bone we don't have fat, but in the ligaments we have the fat, and also the muscles attached. So and so we have the crest of the spine also, so the posterior border of the spinous process is known as the crest of the spine. And so spine is not the spine, it is the process of the scapula, which is called as the crest of the spine. And so we have a nice picture of the scapula attached to the humerus, and so if I go very slow like this, I'll finish this in 1 year only. So I just need to pass by, so let me go on slowly. And so like previously I read about some pathology and pharmacology, but unfortunately I don't have the video with me. I posted it on Facebook and also got deleted. I was just editing the Facebook and just got deleted, so very sad about, but it was not up to the mark also. And we have the attachments of the scapula. So it is like the multipennate scapularis, supraspinatus, infraspinatus, the deltoid, the trapezius, and the serratus anterior, and we have the long head of the biceps brachii, and we have the coracobrachialis, we have the pectoralis minor, and my camera is face detecting, so and the long head of triceps, and the teres minor, the teres major, the levator scapulae, and the rhomboides minor, the rhomboides major, the inferior belly of the homohyoid. Okay, let me check in how much is this one. And so it's like the upper limb. Yeah, so I'll continue in the next video, remove my face deduction, and